This station is designed to test your ability to perform a patient assessment of a patient with a chief complaint of a medical nature and voice treat all conditions discovered. You must conduct your assessments as you would in the field, including communicating with your patient. You may remove the patient's clothing down to the shorts or swimsuit if you feel it is necessary. As you conduct your assessment, you should state everything you are assessing. Clinical information not obtainable by visual or physical inspection will be given to you after you demonstrate how you would normally gain that information. You may assume that you have two EMTs working with you and that they are correctly carrying out the verbal treatments you indicated. You have 10 minutes to complete the skill station. Do you have any questions?
No.
You respond priority 1 to the scene of a 62-year-old female patient complaining of chest pain.
All right. At this time, my BSI is on. Is my scene safe?
Yes.
Is this my only patient?
Yes.
Nature of illness is chest pain. I would go ahead and request ALS backup just because of the nature of the illness and get them en route. Has my patient fallen or done anything like that that might clue us in she might have some spinal injuries?
No.
Okay. What does my patient look like as I approach her?
She appears to be in some distress.
Okay. As I approach her, I'll say, "Ma'am, I'm Rob with the ambulance service. Did you call for help?"
Yes, sir.
Okay. Do you what seems to be the trouble today?
I have some chest pains.
Some chest pain. Okay. My patient is alert because she's talking to me. Chief complaint is chest pain. Her airway is open because she's talking to me, and she's breathing because she's talking to me. What's the rate and quality of her breathing?
20 and somewhat labored.
Okay, at this time I'd probably go ahead and put her on 15 liters O2 non-rebreather mask. Do I get adequate ventilation with this?
Yes.
Okay. I would then check a radial pulse. Does my patient have a pulse?
Yes.
What's the rate and quality of the pulse?
120 irregular.
Okay. Skin color, temperature, condition?
Pale, cool, and clammy.
Do I notice any major bleeding anywhere?
No.
Okay. At this point, I'm going to call my patient a priority patient. We would go ahead and move her to the ambulance, collect her medications, and we would continue our assessment en route. Now that we're en route to the hospital, I will start asking her some questions. Can you tell me how this pain came on you? Was it sudden or gradual onset?
It's been gradual this morning.
Okay. Does anything make it worse?
When I exercise, like this morning, I was walking the dog.
Okay. Can you describe the pain to me, what it feels like?
It feels like somebody pushing on my chest, very crushing.
Okay. Does it move anywhere? Does the pain go anywhere else other than your chest?
It started to move down my left arm.
Okay. On a scale of 1 to 10, 10 being the worst pain you've ever had and 1 being nothing at all, what would you describe this as?
Probably an 8.
Probably an 8. And how long has it been going on?
A couple hours.
A couple hours. Are you allergic to anything that you know of?
Penicillin and sulfa drugs.
Okay. Are you taking any medications right now?
I took some Maalox this morning.
Okay. Any other medications?
No. Doctor gave me some nitro.
Some nitroglycerin for your chest pains? Okay. What kind of past medical history do you have?
I've had 2 small heart attacks.
2 small heart attacks in the past. How long ago?
Oh, maybe a couple of years ago.
Okay. When was the last time you ate?
Ate breakfast this morning a couple hours ago.
Okay, and what were you doing when all this started?
I was out walking the dogs.
You was out walking your dogs. Okay. At this time, I would probably do a focused exam focusing in on the lung fields. What are her lung fields like?
They're clear.
Okay. Might open her shirt a little bit. Do I notice anything on her chest?
A cardiac scar?
Cardiac scar. A small heart attack? Was that from your small heart attack?
Yes.
Okay. At this time, I would contact medical control and see if I can get orders to give nitroglycerin.
Medical control says you can give up to 3 nitroglycerins.
Okay. I'm going to have to check a blood pressure before I can give the nitroglycerin. What's her blood pressure?
90/40. Or 130/80.
130/80? Okay. And what is her pulse ox?
99%.
99%. Have you taken any Viagra lately? I'm sorry, I got to ask that
No.
question. Never taken Viagra?
No.
Okay, at this time, I would get her bottle of nitroglycerin, make sure that it's hers, make sure that the expiration date is good, make sure that I'm giving it to her and not someone else, and make sure that I'm giving it through the right route. I would take the nitroglycerin, put it in the cap, and drop one underneath her tongue. I'm probably going to wait 3 to 5 minutes, recheck her blood pressure. Is there any change in her blood pressure?
No.
Okay. Is the pain any better, or is it about the same?
It's the same right now.
About the same. Okay, doctor says we can give up to 3 nitroglycerin, so let's go ahead and give her another nitroglycerin. Wait 3 to 5 minutes. Is the pain any better?
No.
Okay, and I'm going to check a blood pressure.
Your blood pressure is now 90/40.
90/40, okay. She's fallen out of the criteria for nitroglycerin, so I'm not going to give her any more nitroglycerin. At this point, I would go ahead and lay her head down and put her feet up, trying to get her blood pressure up a little bit. At this time, I'm going to reassess. Is the pain any better, or is it about the same?
It's down probably a couple points, just a little bit.
Maybe about a 6.
Maybe a 6.
Okay. What is her breathing? What's her breathing rate quality now?
It is 20 non-labored,
20 and non-labored. What about her pulse rate?
100 full and regular,
Okay. Blood pressure? Any change in the blood pressure?
100/70.
It's back up to 100/70. Okay. I'm still going to stay away from the nitro. At this time, I'm going to recheck my oxygen. Is my oxygen still running?
Yes.
Okay. I'm going to recheck my lung fields. Lung fields still clear?
Yes.
Okay. I'm going to continue to assess my patient en route. Mental status still the same, still alert.
Yes.
I'm going to continue to reassess my patient en route and advise the hospital en route.